Hi everyone, welcome back to Forward Therapy. My name is Kelly. I'm a certified hand therapist. Today's video is all about the new grads, the students, people who are moving into healthcare settings, and I am giving you my 5 to 6 hot tips, basically my tips of the trade, things that might not be on your mind, but things that I definitely would tell myself if I was going back in time and I had just graduated and was getting ready to start my career in occupational therapy. This could be good for any PTs, OTs, SLPs, any rehabilitation professional in the healthcare world, and let's get into it. So my first hot tip is to utilize all of the continuing education, tuition reimbursement, or education leave benefits that your company provides. When you're interviewing for a job, you should ask what the tuition reimbursement or continuing education benefits entail, and remember that that is also something that you can potentially negotiate in addition to your pay or PTO or other benefits. Remember that continuing education leave or fund of money to use for the year is something that you most definitely can negotiate or inquire about. It is usually something that expires at the end of the year. They give you a bank of money or a bank of education leave hours, and you want to make sure that you're getting the most out of those benefits because you'll use it or lose it, basically. Just to give you an idea, so I live in California, in the Bay Area. In private practice for my first job in the hand therapy world, I believe we got about $1,500 a year, which I felt like was very fair in that setting. We could use it for continuing education, conferences, courses. We could use it for professional memberships like ASHT, AOTA, all those types of things. In the current job that I'm at now is a larger hospital-based setting, and our benefits are $3,500 a year for courses. We can use that for travel expenses to a certain amount. And then we also have education leave, so every year we get 40 hours. Those do accrue, luckily, so if you don't use them one year, you can use them the next year if you need to, but it's nice to be able to have a day off to go to a course and not have to use your PTO as well. I don't know if that's typical. I think it's very generous, but again, large hospital-based system is going to have different benefit structure than like a private practice clinic. But it might be good to inquire in your area, right? Because it could be different from state to state or city to city or just setting to setting. So if you know other therapists that are in similar careers, in a similar field, it might be good to ask what their benefits are so that you know going into your job interview. And my second hot tip is similar to the first. Actually go to conferences, join professional organizations, local chapters, look for courses in your area or across the country, because it's a really fun way to actually learn and get all of the information that you can, and also meet people in the field. When you're new, you just want to absorb as much information as possible, so look up some of these different organizations or associations that can help you be successful. If anyone out there needs a professional organization to join, the Hand Therapy Association of California, which is kind of local to the northern part of California, we're local to the Bay Area. We welcome anybody from anywhere to join. Our monthly educational seminars are virtual and usually on Saturday mornings, Pacific time, so they're open to anybody. I believe it's $50 a year, so it's a pretty reasonable fee. You get 12 meetings a year, and then we actually also do have an annual conference, which alternates between annual and virtual. So if you need some professional networking and professional organization to join, HTACA is a really good one. Next, I think it's so great if you work in a setting where you have colleagues working with you. In hand therapy, it's very common that you'll all be in kind of the same area, the same treatment room. So you can eavesdrop, listen to what they're telling their patients, the way they explain things. You can learn and get information from your colleagues passively without even having to have a huge, discussion. And then you can talk with them about it after, certainly, too. But I do this all the time. I find that being in the same room with people, they have a different way of looking at things, explaining things, and sometimes they have a great way that I've just never thought of before. So I'll kind of use that in my practice, too. It's also good to, have collaborative discussions with your colleagues. So not just necessarily point blank, like, I have this question, please answer it for me. But have some sort of idea so you guys can have a discussion about it. I like to do this with my colleagues too. If I have a really tough case or something that, I just want to ask their opinion, I'll say like, hey, what do you think you would maybe do in this case? Here's this patient that I have. Here's how they're presenting. Here's kind of what my thoughts are. Like, what do you think? So it's really helpful, kind of learn from your colleagues, your coworkers, and people around you to help you better yourself in your patient care. This tip is so important that I'm going to say it twice. Set boundaries. Boundaries, people. Okay, this is a very hard thing and something that I am actively working on 7 to 8 years into my career. It's still something I have to think about daily and weekly. This is ultimately a job. Yes, you love it. Yes, you might have complete passion about it, but it's a job. Don't work for free. You should not be working through your lunch breaks. Try not to stay late or come in super early because you're off the clock and you're not getting paid for that time. Try to finish as much as possible as you can within your scheduled workday. Totally understandable. There are going to be some days where you just can't stay within that bounds. But if it's happening frequently for you, where you're having to work through your lunch, you're having to stay late after work to catch up on all your charting and notes, you need to reflect on that. Is that something that is your internal time management? Is it just that you're new and you're kind of like learning and this is a temporary thing? You don't want to fall into that pattern. Or is this something truly where, maybe it's just the workflow is just not set up in a way that's conducive to you finishing your work throughout that time? And hopefully, if you don't have a toxic management situation, talk to your manager or your leadership team. They're there to support you, or they should be there to support you. So you can come in with this, understanding of, hey, I'm having trouble with this. I need some help. Is it something where they can help you work on some time management skills? Maybe you guys can develop a template so that when you're doing your charting, you already have kind of this form that you just fill out that makes it a little easier so you don't have to free write. Kind of brainstorm with them, see if there's anything that you guys can come up with together that doesn't hurt patient care, but also helps you get out of there on time. Don't work for free. Don't work through your lunch, okay? I mean it. I still have to listen to this advice myself because sometimes I do it and I need not to, so don't do it. And my last tip is learn all that you can, but also give time for yourself to have fun and have a life outside of your field or outside of work. Hand therapy is a passion. I totally understand. I feel that way too. It's easy to get sucked in and feel like all you want to do is study, go to courses, think about your patients when you come home. Super easy to get stuck in that pathway, and you probably will a little bit when you're first starting, but try to give yourself breaks, right? We just want to learn all that we can, and I really believe that hand therapists are such driven people, and we're so in tune with what our patients need, and we love learning about everything hand therapy related, but you have to let go of that at some point too. You have to kind of step away. There's definitely times where you can be studying and learning, but there's also times where you need to set aside for yourself, for things that are good for your soul. Being with friends or family, or going to the beach, or cooking a nice meal for yourself. Like, get away from it some of the time too. And I know that sounds like very obvious advice, but it's something that I really struggled with and sometimes continue to struggle with. So it's an important thing. Just make sure that you're giving yourself time for yourself. You can never know it all. I promise you that you will still learn in 5 years, in 10 years, in 20 years, you will still be learning. You will not know everything there is to know about everything. I'm still learning all the time. And sometimes you just need to give yourself grace and patience and remember that nobody knows it all and that it's okay not to know it all, and that you also need to do things that are good for you too. So those are my hot tips for new grads. Sorry about the rambling. I just get really passionate about protecting everybody out there because I am really bad at protecting myself and I don't want anybody else to suffer through that either. So hopefully this was helpful. I wish you the best of luck. I think you're entering an amazing profession of either hand therapy, occupational therapy, physical therapy, speech language pathology, rehabilitation, and healthcare profession. It's an awesome field. There's a lot of goods and bads, but truly it is a good place to be. If you love helping people and you love learning and working with people, you're going to do just fine. Comment below if you have any suggestions for new grads, students, people that are getting into healthcare or hand therapy. And if any of you have questions, go ahead and post them below in the comments and I will get to them as much as possible. Thank you so much for watching.